Sydney health authorities are sounding the alarm this morning, warning they have no idea how many doctors are set to strike over the next 3 days over a bitter pay dispute with the government. The Doctors' Union, which has more than 9,000 members across New South Wales, will walk off the job from today until Thursday, and it's fuelling fears our emergency departments could suffer as a result. For more, we're joined by Health Minister Mark Butler live in Sydney. Good morning to you. Have you spoken with New South Wales Health to make sure the system can handle this strike?
Yeah, I last had a discussion with the New South Wales Minister a couple of days ago when it was clear that the Doctors' Union was deciding not to abide by decisions of the independent umpire, the Industrial Relations Commission here in New South Wales. We talked about our concern about the impact that was going to have on patients. Most obviously, the cancellation probably of hundreds and hundreds of elective surgeries that will be deeply distressing for those patients. But, you know, some of the concerns your intro just talked about, potential impacts on emergency departments, are going to have to be managed very, very carefully by the New South Wales health system. I just urge both parties, get back to the table. This is ultimately going to hurt patients and hurt the system. We need you both back at the table resolving this wage dispute. The Commonwealth is putting more money into the hospital system here in New South Wales and in every state because we know there is wage pressure for doctors and nurses and other health workers, but we need people continuing to function a health system in the interests of patients.
Okay, let's go to mental health. I notice you're committing $1 billion to improving mental health services across the country, but I also noticed you guys cut, didn't you, to 13 mental health organisations earlier. Is that sort of replacing some of the money you've taken out of the system?
Well, no, we had the first competitive round of bids for digital mental health services in the last 12 months, the first in over a decade. We thought it was important to go back to the market and see what digital services were there. So a whole bunch of new services are now being funded by the Commonwealth. But for those who missed out, existing services funded by the Commonwealth who didn't succeed in that bid, we're continuing to fund because we want to take a no-losers approach there. So there's actually more digital health services in mental health being funded by the government. This $1 billion investment in the mental health of Australians, particularly young Australians, is new investment, new walk-in Medicare mental health centres right across the country, new and upgraded headspace services that your viewers will be familiar with, providing great support to Australians in their teen years and early 20s when so many mental health disorders first emerge, but also this new program for young people with very complex needs, psychotic disorders, complex eating disorders, personality disorders. They've been languishing in what Pat McGorry, the former Australian of the Year, calls the missing middle. And for the first time, we'll have a comprehensive complex care service for those young Australians.
Yeah, it certainly does affect a lot of Australians. Mark Butler, thank you very much for your time.
Thanks, Nat.
Here's Sherbo.